My name is Richard Mwangi, a consultant audiologist and audiovestibular medicine consultant, partnering with Ponea Health, and today we're discussing vertigo. Vertigo is a sensation of loss of balance, or what people say that they have a feeling of spinning effect. You find the patient complaining that when they turn to the right or to the left, they find that the world is moving, so to say. And most of the people experience one once in their lifetime, though not serious, but at some point you'll feel it. You'll find that the description of vertigo will be when the children, when they are young, turning around and falling down and then finding everything spinning until they stabilize. So that will be the simple description of vertigo. It's a spinning, sense of loss of balance that sometimes will need clinical intervention. Now you find that in vertigo, there's so many causes. And to diagnose the vertigo, we'll have to discuss history taking is very important. So we discuss with the patient when did it start, what had happened prior to that, have you had your head knocked, have you had an accident, do you have a hearing impairment. History taking in diagnosis of vertigo is very important so that we know what are the tests required, what is necessary step to be taken, and how is the treatment or management of this condition need to be done. Now, after taking the history of the patient, maybe the patient says, I also have a hearing problem. You'd want to do a hearing test because some of the causes of the balance, they are also associated with hearing impairment. In a condition we call Meniere's disease, you'll find that there's a hearing impairment and still the patient has got imbalance. So it's very important when you're taking the history to ask the patient about their history of hearing, the history of whether they have had accident, whether they have got a traumatic experiences like accident, all those kind of things. Now, some of the predisposing factors of the hearing impairment of vertigo is that so in occupation, where you find that people are engaged into kind of a sound, loud sound. We talk of maybe in entertainment industry, you find the booming sound of the speakers can cause the displacement of what you call otoconia or otolith in the vestibular organ, which is so close to the hearing organ. So that's why these two speciality, you cannot differentiate them. And that's the time you say is the science of hearing, human hearing and balance, or what we call the audiovestibular medicine. So once you do the hearing test, you find the patient has got hearing impairment, you would want to do the balance test, which the balance test is a series of tests where the patient will have to have some special goggles with the cameras inside, and then the movement of eyes is monitored, the body movement is monitored. You'll have to put the patient into different position. So it's a battery of tests that has to be conducted when diagnosing the vertigo, or what you call the imbalance in the patient. Thank you for joining us today in this discussion. You can book my services at ponea.com. We look forward in engaging you more in the next episode.